Well, thank you very much for the kind introduction. Hello, everyone. I guess good afternoon to some and good evening to some others out there, but overseas. But we have, I've been involved in light technology now for about 18 years. I've been in electronic development for 40 years, developing a lot of different equipment for different people, different types of technologies. But in the last 18, it's been revolved around medical. Some of you, the LED lights for curing the white fillings, I was involved very early on in developing that kind of technology as well. But about 15 years ago, I developed a light that once I learned how light can be very, very beneficial, I developed a light that can go wherever. And this was my earlier version. So this was the first powerful unit that I had, and was quite powerful compared to anything else on the market. And so I've got about about 16 years with PBM experience with this type of light and how it can reduce pain and inflammation where people have migraines and just a host of different problems, healing. And Dr. Mel and Dr. Bridgman both have mentioned how well this has worked for different things, and I've seen it. I've seen it firsthand. But as you can tell, this is pretty bulky, but it was a lot of light power at the time. And as you can see, it's going right. Well, you can see it going right through my hands there. But I realized about a year ago that I could do new things with the LED technology and developed a small unit, and that's this unit here. Now, this unit actually has more power than the predecessor in both of the two different wavelengths. And that is quite important to have power and also illumination area, which I'll talk about. Okay, so let's go to the next slide, please. And I guess I can adjust that, or I'll just ask for it. How's that? So it's been discussed already this morning or today, how post-operative pain, acute pain, facial pain, TMJ, TMD, slow healing problems, dry socket, orthodontic pain, troubles with addiction, with opiates, pain medication, inflammation, whether that's inflammation in the jaw or, as I mentioned, people have inflammation in the hands and that kind of thing, arthritis, you name it. You have inflammation, and that causes a lot of pain, and nobody likes pain. The aspect of needing units that could be used for personal use as well. And I just want to mention one more thing before I go to the next slide, is that these problems are there and they can be handled very directly with PBM, with light and light technology. And the course so far has explained in great length why certain wavelengths are very beneficial in speeding up the healing, reducing pain, and that right away. I mean, even I've got several kids, and they've had their wisdom teeth removed, and they've got a father who developed PBM technology. So all three of them that had the wisdom teeth removed, they did not need to take any of the prescription medication for pain. As soon as the pain started coming on a bit, they used the light, the other light that I showed you earlier, and they could get rid of the pain right away and go right back to going to sleep or during the day without taking medication. So if we can get the next slide, please. Okay, I'll just let you do one thing there to have a look at that slide a little bit about solutions, and I'll speak to it in just a minute. I also want to do everybody a favor and not talk too long, so I'm putting my timer on. So bear with me for a sec. There we go. All right. And you can tell I never needed these before, but now I do. So got some age on me. We talked about the pain medications and the possible addiction to opiates, as was mentioned earlier. The big thing here is that if you have enough power, you can get shorter treatment times. And in this case, we can deliver on this device here. There's the two wavelengths. So one of them's the near infrared. You can barely see it. It's because the camera can't pick it up. But even a cell phone camera can pick it up. But the other wavelength is 660, and you can see that quite easily. And it's because of the power in the very large area on this that allows you to get not only a large treatment area, so you can treat several trigger points or acupuncture points at the same time, but you can also get the depth that's needed. Okay. Dual wavelengths, I talked about that. Less antibiotics. I'll just mention, for healing, speeding up healing. One of the fellows that had a significant bone graft done in his mouth, a very large bone graft, and the dental surgeon had come back, saw his patient 2 weeks later, and he couldn't believe his eyes. He says, I can't believe it. You've got 4 weeks of healing in just 2 weeks. And his patient, who is a friend of mine, said, well, I have this light technology that can help speed up the healing. And his surgeon said, no, that's got nothing to do with it. You just must heal fast. It's something how some people just have a hard time believing that light can do this, but it really can, whether it's internal or external. Can I go to the next slide, please? So then the neat things is that you can lessen pain right away. In some cases, it's immediate. In some cases, it takes more time. All depends on and it may be a pain that comes back. And then if it comes back, well, you just use the light a little bit more and it goes away again. And eventually that is not needed. And there was other things like TMJ and TMD that was discussed already. Provides an analgesic effect, promotes overall healing, faster healing, less complications. And anytime there's less complications and faster healing means that that person is not going to come back and use up your chair to tell of how much pain or inflammation and want you to check it out. So not having to do that means you got a happy patient there. Requires less antibiotics, and as I mentioned, the very large, I might come up back to that topic a few times, but this is a very large area. This is 40 square centimeters of light area and one shot. So that helps because you can treat many different spots at the same time because of the large area. That's going to save you some time in the treatment. And because of the, as I mentioned before, 4 joules can be delivered in 30 seconds or 45 seconds to 46 seconds, depending on whether you're looking at which wavelength you're using. Can I go to the next slide, please? Okay, and I just mentioned that happy patients, they're going to be your business builders, and they're going to tell other people and with their satisfaction that they have. This is going to help increase the number of patient referrals. And the nice thing about this is it's a small form factor, so it's very easy to hold, very lightweight, and it makes for itself to be able to even take it along traveling. It uses it powers up by a wall adapter, and that's very helpful. You don't have any batteries to replace in that. And you can, like I say, you can switch to that's one wavelength. You can switch to the other wavelength. Portability. Hey, I will talk about that in a bit. As far as the cost on this is a very reasonable price on this cost on this device. We tried to do that so that more people can make use of it. But you might as well have then one at home and one at work. And that way, when you're at home, something happens to you, you do some kind of handiwork and you bang your thumb. Well, if you put your light on it right away, you can speed up that healing for burns, for cuts, even colds, first aid treatment when you're on the road. Some countries that you go to may not be as well equipped with their treatment plans, how they can help people, and to have one of these along. Another good example is one of my one doctor that's loves her light, bought it for her 2 sons that had some kind of weird condition, and she tried everything in the book on the pharmaceutical side. Nothing worked, and she was able to get both kids got their lives back because they didn't have to go through these bouts of pain for days. But in her own situation, she has an ankle that's weak, and I know what that's about. You roll your ankle, you just touch on the just a little uneven surface, and you roll your ankle, and you get this bruising, severe pain, sprain, and very difficult to walk after that. She would do that often, and she said she normally would roll it so bad that she'd be on crutches for like 2 weeks. And in one of the cases, one of the times she had healed up and she was doing fine again, and another time she rolled her ankle, and this time she had the light, so she put the light on the ankle area, and she called me back. She was so surprised because the next day she was able to start putting pressure on the foot and be able to walk away after a few days, be able to walk without even crutches, which just blew her mind. And she's a total sold out candidate on PBM. Can I have the next slide, please? We make, my company makes a number of different devices. If you check out KerberUSA.com, there's the dental device is not mentioned there because you guys are getting a special. We've developed something special there. But I have a device that's not only a smaller version of this, just a much lower powered version of this, but I have a canopy, mini canopy that does a part of your back area in one, and then a large canopy that does your whole body. It's an absolutely beautiful machine. Anybody who's done very well in their medical practice and wants to have one for the home, we can work something out, I'm sure. But it's available as well. We also are doing some COVID trial work that's coming up overseas as well as in Canada. And if there's any connections out there of any doctors, any never can pronounce it right, those that work with lungs and air breathing, pulmonologists, there we go. We would love to start another trial, but this light here is comparable in light power to actually reduce the inflammation, and we want to prove it in a trial and inflammation in the lungs. So it's really a wide range of technologies, but this one is very much catered to the dental, and the price point is we're offering a $200 special right now for those that are involved in the symposium. Can I have, oh, Jerry, yes. And by the way, if there's some questions that come along, I welcome them. We'll deal with them a little later. Jerry, I just noticed your picture pop up. Is there something you wanted to say?
No, just when you're done, I'll address it.
Okay, all right. Okay, so it's very, very durable and built-in number of built-in safety features, and it's FDA registered. Can I go to the next slide, please? Here's examples of treating a masseter muscle and also temporalis muscle, and so you could treat such a large area like that in 30 or 45 seconds, depending on the wavelengths that you're using. Different wavelengths has been already spelled out in some of the presentations already. There's different wavelengths. Of the two are certain ones react to certain wavelengths, other react better to others. So the 810 nanometer tends to penetrate deeper, but the 660 has its benefits as well. Then, I've known of those that work with their hands a lot. Carpal tunnel is an issue. Yeah, so it's very easy to treat. And I've had one person who's actually splinted up, and they were in that position for over a year wearing these splints constantly, and they're totally free of that kind of problem. So here's just a quick summary: large area illumination, high power output, and that power is all over the whole area. So it's not like that you have a hotspot, and I'll talk about it. And that gets into the safety. It's a very safe device to use, and it's easy enough to operate. You just turn on the switch for the time period that you want to do the treatment, and that's how it is used. Very lightweight, and that's because of some patent pending air cooling design so that it can be very light. Otherwise, this unit would be a lot heavier. And the neat part about LEDs is LEDs are will last, like these LEDs in here, the way I'm treating them with the design, this is like 50,000 hours that you could have on this kind of device with LEDs, and they'll still run after that. I wanted to show you this picture. It just shows you, this is a picture taken with a standard camera. Oh, sorry, a cell phone camera. Okay, nothing special. On the one side, you see on the left side, you see the 660 nanometer. It's a little hard to see, but you can actually see a little bit of the light penetration through the gum line. In the case of the 810 nanometer, you can see it's quite obvious that it's passing right through the bottom area of the teeth and through the gums quite easily. Can I have the next slide, please? Okay, this I wanted to point out, is that a lot of people don't know, with seeing James Bond movies out there, and how with light from a laser, it's a point source. So if I do a little quick demonstration here, this is a little laser pointer, and you may have seen that. You can see, and even as I pull back the unit, it's a little hard to see, but even as I pull back the unit, it still stays as a spot. If I use the LED that's on this device, now it happens to be a white LED, but it gives the same effect, is and I'm going to just turn off this light for a moment because it's a little easier to see. There's the, there's the LED, but as I pull back with the LED, you can see the spot size getting larger and larger. Now, that doesn't have, the neat part is, when it comes to, Jerry had mentioned about it, that when it comes to, can I go back to that slide, just back again, just one sec here. I guess I can, there we go. Okay, so what I want to point out here is that light, if it's a dot on your finger of a certain power, or as in the left-hand bottom corner, you see the light is distributed evenly over my whole finger. On the other side of your finger, after it passes through, it really doesn't make any difference whether it's, like in this case, it's 3 milliwatts, but if you're talking a 1 watt laser or a 5 watt laser, when you compare apples to oranges, if they're the same power, it doesn't matter whether it's a LED or a laser with a diffused tip. That power, once it hits the skin, will diffuse in all directions. So even I take this laser pointer that I was just showing you, and I put it up, and you can see that it's covering my whole finger. It's no longer as a dot as it started, but as soon as it hits the skin, it spreads in all direction. So the next page is, although we're recommending that you wear glasses, and that you know, there's different OSHA and WMIS up here in Canada, but it's not like, because of the area spread out, it's not like you would have that immediate hot spot on your eye. So that's the safety that you get. And I think you mentioned, Mel, that you could, one of the lasers, you could, 2 football fields away, you could still have a spot that, oh, and sorry, that was the fellow with the, I'm not sure, but the beam is such that it stays, many of them can stay as a dot, so that can continue to go straight as a dot on the back of the eye. But with an LED, you're distributing that power over that whole area. Okay, if we go to the video, we have a short video here. We'll just gauge it by its length. I think it'd be informative as a woman who has TMJ, and what you might see from a real person who's in the dental field. Can you play that for me, please? She's a dental hygienist, and I think you'll find her quite interesting.
Hi, Tom. I just wanted to make this little video and let you know what I've thought about your light. As you know, my TMJ has been pretty much in a lockjaw mode for about 2 years now. I did go to the oral surgeon. I was on amitriptyline, 50 milligrams, and I also went to my arthritis doctor, as I figured maybe this is my arthritis reacting in my jaw. He prescribed a muscle relaxant. So since using your light, to be honest, the first week I was doing really well. I was 3 times a day regularly. I'm using my little guide to measure my jaw. That's as big as I can get. I started at 3 centimeters opening. Right after the first 15 minutes of having the light on the muscles on this side and under the jaw, I was up to 3.3 millimeters. So 15 minutes later, it felt like I was opening really wide, but it did feel like the muscles were relaxed right away. So over the days, I was getting further and further along each day. So in the overnight, I guess I'm clenching at night. That would exacerbate it a little bit. So I was going from 3, I'd get to 3.3, 3.5 by the end of the day with 3 treatments, and then overnight I'd slip back to 3.2. The next day, after starting at 3.2, I would get to 3.6 and then slip back to 3.3. So small gains, but for me the big thing was I can feel these muscles relaxing. They are ropes. My masseter muscle, the buccinator muscle, any movement sideways just crunches in my ear. I have been having ear pain as well. But yeah, since using your light, I've decided to stop the amitriptyline. I don't think I'm getting relief from that. And I'm still taking the muscle relaxant here and there because I've fallen off the bandwagon a little bit. I haven't been able to do this 3 times a day as I'd like. But yeah, I'll show you what I've been doing. I got your light here. So I'm just placing it on my cheek. I've been putting it underneath and just basically sitting here for about 15 minutes or so. But what I'm finding out is that a lot of this that's actually up in the joint might be referred pain from these muscles just trying to hold onto it. So thank you so much for your light. I'm hoping I can get on a better routine again because I think it's going to make a big difference, to be honest. I was pretty skeptical, but yeah, I'm glad to be off the amitriptyline, and I'm
Thank you. Thank you. So this is the basic specs of the unit where we're talking radiant intensity of 137 milliwatts per square centimeter over that large area. That's at 660 and 87 milliwatts at the 810, which was mentioned before. 4 joules you can deliver at the surface in 30 seconds, or 46 joules in there's a typo there, 4 joules for 810. Plugs in the wall, pretty simple to operate, and yeah, FDA registered and patent pending. Thank you. If you want to move to the next slide. So if you'd like to click on the button above to learn more and be able to purchase this unit at the special price, please go for it. And just think about the times that you could help those also outside of your dental practice, where you maybe for your mother or father, or just to have one around home for challenges in your own family when it comes up. So I can answer some questions here. One of the questions is how long and how often do you recommend using this? This is something that you definitely you can see really good results with once a day treatment. I mean, I've seen people stretch it out to a couple days, but I mean, if I found some really good, even faster healing in some cases, where somebody, if they take it home and they do 2 treatments a day, morning, nights, something like that. Do you get protective glasses with you with this unit? I do not provide them. There's the other one that's on the website there that has some great glasses. And the nice thing about this is because it's quite safe, so you need to find out what you need to use. This is 660 and 810 nanometer. And again, it's because it's diffused, it's pretty good that way. It doesn't have those hot spots. Okay, let's see what else. I guess I can move this thing along here. Sorry, I'm just getting used to this. Mel, would you like to offer some comments here?
I think it's a very, very nice unit. The ability to have that large head makes it very nice to work with. You can get a lot of energy in a short period of time. So yes, it's a good one. How about you, Jer?
Well, I was gonna say, we're gonna talk a lot about this when we get to TMJ. But I'm basically using it myself for my knee on a regular basis. I've got arthritis. I had a PRP injection, so I used the PPM to stimulate the stem cells and the growth factors, and my pain's down by 95% from when I damaged my knee. It's arthritis in my knee. So thanks, Tom. So we've got about 10 minutes left before the next presentations. So we're going to go back to 10 minutes of questions. If anybody's got any other questions, shoot them, and whichever one of us are appropriate will answer the question.
Okay. Thank you, Tom.
Okay. All right. Excellent. Thank you for the time. Yeah. Bye for now.